As a state representative in Massachusetts, I have dedicated myself to an agenda that supports social justice. I have fought to end discrimination, and I have fought for services for the most vulnerable. I have fought for marriage equality in this state and for women's rights and for the rights of the most disadvantaged. And I have fought for social programs. I, by the way, have the distinction of having been the first psychologist to ever serve in the Massachusetts legislature. There have been only a few social workers among my colleagues, and so being a mental health professional is a real minority in the legislature, but we bring a really important perspective. I think we bring a recognition of how public policy is ultimately about the individual person. Government has two main purposes. The first is to provide for the common good, to protect the entire community. But the second, which is just as important, is to make sure that the needs of the most vulnerable are addressed, that the people who would otherwise be shut out and left behind, that their needs are addressed. And that's why social work as a profession is such an important partner to those of us who are working in government.
Hello, how are you?
There are a number of accomplishments that I really am proud of. At the top of the list, I would say, has to do with the healthcare reform effort that we live through here in Massachusetts. What I'm proud of is that I played a role in making sure that as we move forward with the plan to make sure that everyone in Massachusetts received healthcare coverage, it was really my leadership that resulted in that universal health care plan protecting people with mental illness and substance abuse. I'm also very proud of getting through mental health parity legislation last session. What mental health parity is it means that health plans are required to cover all psychiatric conditions to the same extent that they cover other medical conditions. I'm also proud of passing a bill last session that was specific to the social work profession as a result of the legislation that I filed along with the Massachusetts chapter of the NASW. Social workers in Massachusetts are not required to sign agreements that would keep them from continuing working with their clients. Now that helps the social worker, but more importantly it helps the mental health consumer who now has the option to continue treatment with the provider of their choice.